Hi everyone, I am Roslyn Anita, nursing tutor in Tribhulam College of Nursing. Objectives: Introduction, types of poisoning, causes of poisoning, symptom of poisoning, diagnosis of poisoning, treatment of poisoning, prevention of poisoning, poison control centers and resources. Introduction: It refers to the harmful effects that occur when a person is exposed to the substances that can cause injury, illnesses, or death. These harmful substances, known as poisons, can enter the body through ingestion, inhalation, injection, or absorption through the skin or mucous membranes. Poisoning can affect various organs or systems in the body, leading to the range of symptoms from mild to life threatening. Types of poisoning: Ingested poisons. These are substances that are swallowed and absorbed through the gastrointestinal tract. Inhaled poisons, substances that are breathed in and absorbed through the lungs. Ingested poisons, these substances are introduced directly into the body through a needle bite or sting. Absorbed poisons, substances that enter the body through the skin or mucous membrane. Causes of poisoning: Accidental, that is unintentional exposure to the toxic substances, often in the home or workplace. Example: children often ingest household chemicals, cleansing agents, or medications. Intentional, deliberate ingestion or exposure to poisons, including the self-harm and homicides. Example: self-poisoning, that is suicidal attempts by injecting harmful substances, overdosing on medications, or poisoning with toxic substances like pesticides or chemicals. Environmental, exposure to pollutants, contaminants, or hazardous material in the environment. Example: exposure to the industrial chemicals, pesticides, or pollutants in the air, water, or soil. Symptoms of poisoning: gastrointestinal symptoms: nausea, vomiting, abdomen pain, and diarrhea, blood in vomit or stools in severe cases indicating damage to the digestive tract. Coming to the neurological symptoms: headache, dizziness, and confusion, seizures or unconsciousness, slurred speech, vision changes or difficulty breathing, muscle weakness or tremors. Coming to the gastrointestinal cardiovascular symptoms: rapid or slow heartbeat, arrhythmia, low or high blood pressure, shocks which may result in weak pulse, rapid breathing, or loss of consciousness. Skin symptoms: burns, rashes, or blisters in case of skin exposure to the toxic substances, sweating, flushing, or pallor, paleness. Coming to the respiratory symptoms: difficulty breathing, wheezing, or coughing, especially in cases of inhaled toxins like smoke, carbon monoxide, or chemical fumes. Cyanosis, bluish color around lips, fingertips due to lack of oxygen. Diagnosis of poisoning: medical history, the patient's symptoms, potential exposure, and any known substances they may be in contact with. A critical in diagnosis poisoning: information of on the exact nature of the poison, whether it's chemical, drug, or toxin is essential. Physical examination: a thorough examination of the patient focusing on vital signs, heart rate, breathing, blood pressure, assessing any signs of damage to the specific organ, example liver or kidney. Toxicology test, blood, urine, or other bodily fluid test may be used to identify the presence of specific toxins or drugs. The common tests include the blood gas analysis, urine toxicology screen, or specialized assays to detect the poisons like alcohol, carbon monoxide, or heavy metals. Imaging: in cases whether the poisoning might have affected the respiratory or cardiovascular systems, imaging tests like X-ray or CT scans may be used to detect the damage. Treatment of poisoning: decontamination, that is activated charcoal. If the poisoning involved ingestion, activated charcoal may be administered to absorb the poison and reduce its absorption in the gastrointestinal tract. Gastric lavage, that is stomach pumping. In case of doctor may use the gastric lavage to remove the poison from the stomach. Emetics, in some cases inducing vomiting may be recommended, although this is not suitable for all poisons. Antidotes: specific antidotes can reverse or neutralize the certain poison. For example, naloxone for opioid overdose, activated charcoal for certain drug overdose, atropine for organophosphatase pesticide poisoning, methylene blue for methemoglobinemia caused by chemicals like nitrates. Supportive cares. This include managing symptoms such as the administering oxygen in case of carbon monoxide poisoning or using IV fluids to treat the dehydration and maintain the blood pressure. Hospitalization. Some cases require intensive care such as monitoring heart function, respiratory support, dialysis in the severe poisoning. Prevention of poisoning, that is safe storage. Keep medications, cleaning products and toxic chemicals out of reach of children and pigs. Pets. Use child-proof containers and safety locks. Proper labeling. Ensure that all the potential hazardous substances are clearly labeled and stored in the original container. Use protective equipments. In industrial setting, workers should use appropriate protective equipments, gloves, masks, etc. when handling the toxic substances. Prevent overdoses. Follow the prescribed dosage of medication and ensure that individuals do not accidentally overdose on prescription or over-the-counter drugs. Environmental controls. Ensure the proper ventilation when using the chemicals or fuels that may release toxic fumes. Use carbon monoxide detectors in homes with fuel burning appliances. Poison control centers and resources. OSLINES contact poison control centers for immediate guidance and assistance in poisoning emergencies. Educational resources. Seek out information from reputable sources or recognizing, preventing, and responding to poisoning. Regulating agencies. Regulatory agencies. Government agencies monitor and regulate the use of hazardous substances to protect public health. Support services, counseling, and other support may be available for individuals and families affected by poisoning. Conclusion. Poisoning is a serious health condition that requires immediate attention. Whether accidental, incidental, or environmental exposure to poison can cause severe damage to the body and may lead to death if not treated promptly. By understanding the causes, symptoms, diagnosis, and treatment option for poisoning, individual can better prevent and manage poisoning situation. If poisoning is suspected, it is essential to seek emergency medical help as quickly possible to ensure the best possible outcomes. Thank you.